So what are cancer symptoms? Actually, it all depends on where the cancer is. So if the cancer is in the lung, for example, and you cough out, then you may cough out blood, or you may have shortness of breath. If the cancer is on your skin and it becomes an ulcer, it may be difficult to heal. Or if it's a mole, it'll grow suddenly. Normally it's stable, same size. One fine day, you realize it's growing. That's a sign, a red flag. You must quickly go and get it attended to, because it may be cancer. A change in bowel habit. Normally you go to the toilet to pass motion once a day, but now it's once every 4 days. And sometimes you have constipation, sometimes you have diarrhea, which normally you didn't have before. Then better get it checked. There could be an obstruction or a tumor growing inside. Change in voice, maybe something wrong with your vocal cords, or maybe a tumor or something growing there, a nodule. Most of the time it may be benign, but if you don't check, you won't know. So these are some of the common symptoms that people may have, and try not to ignore it. Go and see a doctor and get it checked. But there are risk factors that lead to you getting cancer, and this is important to know so that you can modify some of it. Of course, some things you can't modify. The genes you inherit from your parents, your grandparents, those things you can't change. But you can change the kind of insults you put your body through, like smoking, alcohol, things like that. I'm going to go through some. And these are the lifestyle choices or modifiable risk factors. So having a risk factor just means your risk of cancer increases as well. So the more risk factors you have, the higher the chance of getting cancer. But while saying that, of course, anecdotally, you may know some people, chain smoker for many, many years, many packs of cigarette. Why doesn't he get cancer? Then there are some ladies who have lung cancer who never smoked before. So my answer to this is, the person who's smoking who didn't get cancer and lived till maybe 70, 80 years old, if he didn't smoke, he may have lived to 120 years old. So if you want the bonus 50 years, then don't smoke. Okay, because sometimes you may have genes that are very good. Whatever insult you take upon yourself, the body still can withstand it. But if you didn't put your body through this, you will have a much better quality of life. Because smoking, if you don't get cancer, you end up with COPD. And you can't breathe, and you struggle with daily living as well. So tobacco smoking, I'm highlighting this a lot because I think there's still some people, especially older folks, who smoke a little bit here and there. And it's the same, whether it's cigar or pipe, they're all smoke that will cause cancer. So it causes many problems, as you can see. Cancer is just one of many, many problems. And cancer also not necessarily just lung. Bladder cancer, pancreas cancer, all these are caused, esophageal cancer, all these are caused by cigarette smoke as well. And if you stop, some people say, I've been smoking 30 years already, what difference is it going to make now? It does make a difference. They found that as soon as you stop, within a year, your blood pressure will drop. Within 5 years, your cardiovascular risk drops significantly. Within 10 years, your risk of cancer also drops to something near the population, the normal population. So as soon as you stop smoking, apart from saving yourself tons of money, you also save yourself from getting a lot of these other diseases, which normally you are on track to get it, but it can be reversed. Now, the other thing I always tell patients, especially if they smoke in their home where the family is around, if you're not worried about yourself and you don't care about your family, because secondary smoke is a problem. I have a number of patients, females, whose husbands are chain smokers and they smoke at home. And then by the time they come and see me, the husband regrets, but you know, why regret? Stop now, straight away, you reduce the risk for your family members as well. Now, diet. I think diet is something that always comes to the forefront in our mind when we think of cancer, because there's a lot of information out there. Every Thursday you read Mind Your Body, there'll be some person saying that this diet is good, that diet is good, or you read any magazine, and after a while, people get obsessed by it and they seek answers. Unfortunately, if you go and see a doctor, they'll tell you, I just eat a healthy diet, right? But what is a healthy diet? So most doctors, physicians will tell you that it encompasses a lot of vegetables, fruits, and less meat. But is there a specific diet that will help prevent cancer? I think what we know are diets that may promote cancer. So what are these kind of diets? High saturated fat. So apart from protecting your heart, if you eat low-fat diet, you also, in some extent, protect yourself from certain cancers, especially the hormonally driven cancers like breast cancer, prostate cancer, even colorectal cancer. So cut down on high saturated fats. The other thing is red meat. Red meat has been associated with colon cancer. I think the problem is sometimes when people take disproportionate high amounts of red meat, they don't take enough of vegetables and fiber as well. I don't know, for some reason, generally, meat eaters tend to eat less vegetables. I think there's so much your stomach can accommodate, and you apportion a lot of it to meat, then there's less space for the vegetables. And eating less vegetables can also increase your risk of colon cancer. But all these are population-based studies. That means they observe two different groups of patients who, one who have colorectal cancer, one group doesn't have colorectal cancer. And then they look back and ask them, so what is your diet? And then those with colorectal cancer say, oh, I eat a lot of fried, oily, fatty food, a lot of meat, very little vegetables. Those without colorectal cancer tend to say, I eat more vegetables and fruits. So that's how these population studies have given us this information. But this is not the highest quality study. Of course, to have proof, 100% proof, we need to do controlled trials. But it's very hard to do when it's in relation to diet because you need large groups of people. So being overweight is an issue. The other thing is toxins. There's some toxins in diet. There's a mold that can be found in certain peanuts that release aflatoxin, which may cause liver cancer. So this is something you can obviously watch out for. If you see moldy peanuts and all, just be a bit careful. So healthy diet, I think you've seen this everywhere. If you go health promotion board or watch television when they have cooking or mainly nutrition-based shows, they will show you this food pyramid. If you understand this, maybe your bulk of your calories will come from your rice, that will be your staple. Then vegetables in the middle, meat, and finally fat and oil right at the top. But now there are a lot of dietary fads. That means these are trends. People have read articles on, let's say, Atkins diet. They eat just meat and fatty food, they remove carbs from their diet. So there are various forms of dietary fads out there. What I would recommend is read properly first. Don't go by hearsay. Read what are the pros and cons, and if you can, try to understand the scientific rationale behind it. The problem with dietary fads is the word fad. It's very popular for a period of time, then people run into trouble, and then later on they say maybe not a good idea. So this food pyramid has been there from time immemorial. Everybody has been talking about this. You can't go wrong if you stick to this kind of food or this kind of diet. Now, UV exposure. Singapore obviously very hot whole year round, so a lot of sun. But the good thing is a lot of Singaporeans like to use umbrella even in the sunny day. So you protect yourself to some extent, but sometimes you can't protect all parts of your body. The other thing is when you drive, sometimes you also get certain parts of your hand and all exposed to sun. This can cause cancer, but you can take protective measures, use sunblocks with sufficient SPF or sun protection factor to reduce your risk to UV light, which can cause skin cancer. Fortunately, Asians have a low preponderance for this, but generally Caucasians have higher risk for skin cancer. So it's not just the environment, but could be some genetic factors as well. So skin cancers are quite low rates. Now, alcohol. So alcohol, we know, can cause cancers of the GI tract, especially the esophagus, the throat. It can also damage your liver very badly, and long-term liver damage can cause liver cancer. So this is an example. What happens is, if you can see on topmost, the top picture, sorry. You can see that this is a normal liver. When you have a lot of alcohol consumption, your liver becomes damaged. Liver nodules, the liver cells are quite peculiar. They don't regenerate into normal cells again. So they become nodules and they're not very functional. So you can end up with liver failure at this stage. However, in the long run, if it stays like this, it becomes liver cancer. So alcohol plays a major role in that as well. Infection, more and more as we investigate into the causes of cancer, we find that viruses can actually cause cancer. For example, hepatitis, again, because it causes cirrhosis, there's also some mechanism within the virus that drives the development of cancer. So hepatitis B and C can cause liver cancer. Human papillomavirus can cause cancer of the cervix. And this is why, for young females, there's a drive now towards getting them vaccinated. Because if you have a vaccine against HPV, human papillomavirus, then you are much less likely to get cancer of the cervix. The other common virus is Epstein-Barr virus. A lot of Chinese in Singapore, especially those from southern China, their families were from southern China, tend to carry Epstein-Barr virus, and they have nasal pharyngeal carcinoma. Epstein-Barr virus is quite common among many people, but southern Chinese tend to develop nasopharyngeal carcinoma. So nose cancer is quite common in Singapore. Hep B virus, as I mentioned, certain chemicals. So sometimes, depending on what kind of job you do, some people may put themselves at risk for cancer as well. I've seen a few of my patients who work in printing press and things like that, where you got direct contact with dye, the chemicals that print. If they don't wear protective measures, gloves and all that, they may end up with bladder cancer or even lung cancer because they inhale some of these chemicals. So hopefully the Occupational and Health Safety Department looks into this and ensures there are safety measures in place. I know many of you are retired, but in the past, if there was such exposure and you do develop symptoms, you must quickly come and see a doctor just to make sure that it's not related or it's caused cancer. Now, I mentioned to you hereditary cancer. So about 5 to 10% of cancers are passed down from generation to generation. And this afflicts a lot of people, a lot of groups of families. So it's important for us to identify who these people are. So let's say someone has colorectal cancer at a young age. I think it will be good for them to inform their family members that they have cancer. I think sometimes people are reluctant because they feel either ashamed or they feel fearful that this knowledge will cause a lot of sympathy and they don't want all these kind of things. But if it's your own family member and you got it at a young age and you think maybe or you're not sure, you think maybe there's hereditary cause behind it, ask your doctor about it. We have clinics that specialize in cancer genetics and we can test your family members. Now, therein lies a dilemma. So what if your family members know that they have this gene? Here I've written a few genes. BRCA1, BRCA2, these are the genes that have a high risk of a patient getting breast cancer. But if a male has this gene, your risk of prostate cancer is higher. So this is a gene that Angelina Jolie, the actress, had. And because of that, she removed her breast before the cancer developed. Because if you don't have breast tissue, you won't get breast cancer. Unfortunately, that is quite a radical approach. If you don't do that, then you must frequently go for checks if you have this gene, as early as you pick up the cancer. Because why did she do that? Why did she do such a radical step in removing her breast? Her chance of getting cancer was 80%. 80% chance that she will get. That's nearly surely she will get cancer. So the doctors advised her, you have two options. If you don't want to worry about it at all, remove your breast, then you won't get breast cancer. So she removed it. So that is one of the treatment options that are offered with patients with this kind of gene. The other option is close surveillance. That means normally we ask females above the age of 50 to do mammograms. In females who have this gene, whatever age they are, they have to do their ultrasound breast or mammograms in very close intervals. Because once cancer develops, and quite certainly it will, 80-90% chance, quickly you can operate. So they still get to keep their breast, but at some point they may risk themselves getting cancer. So why is this very important? The thing is, if you identify it in yourself, that means your family members are likely to have it. Will they want to know? How will this affect their insurance? I think now, maybe with MediShield Life, a few of these things may still be covered. In the past, it was a big issue. Even now, it's a big issue. If your insurer finds out, how will they react? They know you are nearly surely going to get cancer. So this is something that you have to think about. Second thing is, do you want to know? Because it means you may do drastic surgery, but it may save your life. So I think in balance, it's still better to know, but you may have to think of things like insurance and stuff like that before you do the test. or embark on it. Because if you're already insured, by the time you get to know this, then it's not bad, you're covered. But if you do the test first, you find out you have the gene, and then you want to get insurance coverage, it's going to be very difficult. So that's some of the issues that you may want to think about if you have hereditary cancer, not the most common, 5 to 10%. So when you see a cancer geneticist, he or she will go through a very thorough family history. So this is how we diagnose that maybe the family has cancer. Sometimes different cancers are related. Doesn't mean your family member has breast cancer. If you have the gene, you only get breast cancer. Like HMPCC, which is related to the colon. You can also get endometrial cancer. You can also get urothelial or bladder cancer as well. They're all linked to the same gene. So these are things that sometimes if you see a trend in your family, your cousin has cancer, your sister has cancer, even if there are different kinds of cancer, go and seek some advice from your doctor. It may be linked, and it means if you act early enough, you can pick it up.